Good morning, good afternoon, good evening po sa lahat-lahat ng ating mga manonood at tago-subaybay saan mong panig po ng indaigdig na kayo naroon. Welcome to our 103rd, 103 na po na episode of the Start COVID Deaths webinar series, and this also represents the start of our Season 9. Thank you for being a part of our credible online community. And to all those who have just discovered us for today, welcome po. At sana po masiyahan po kayo sa ating topic for today and for our future topics. 2 linggo na po ang nakakaraan, Cebu City reported an alarming rise in cases of dengue compared to last year. Medyo nagulat po tayo as dengue cases dropped during the lockdown phase of the pandemic po, and as of this writing and as of this moment po, the outbreak has yet to be declared, but cases are increasing, and the Department of Health has changed its advisory to say that the rising cases of dengue is a cause of concern in the Central Visayas. So for today's webinar po, and in honor of June bilang Dengue Awareness Month, we will tackle the topic Dengue Alert sa panahon ng pandemya. Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Fridays. And masayang-masaya po ako na patuloy pa rin pong nanonood at sumusubaybay ang tumatangkilik po sa ating programa. And something that really looking forward po because we spend time with our community members po. But so at this point po, I usually start my introduction of my partner and our adjunct research faculty, si Dr. Susie. However, meron po siyang there's been a death in the family, so we are offering our sincerest sympathies and deepest condolences po, to Dr. Susie and her family, and we pray for the repose of the soul of her mother po. So maybe we could take po a few moments po of silence just to remember. Okay, maraming salamat po, And then, co-hosting with me and keeping the seat warm for Dr. Susie is our ever reliable po, pinch hitter. She's the Assistant Vice President for Public Affairs and also the Director for the Office of Alumni Relations of the University of the Philippine System. Very, very important din po siyang miyembro ng UP Diliman Extension Program in Pampanga, bukod po sa being a crucial member po ng ating Stop COVID Deaths webinar series. Please welcome to your screens again, AVP Rica Abad. AVP Rica.
Hi, hello everyone. Good afternoon, Dr. Raymond, and welcome to all our participants here in the live broadcast of Zoom, and to all those watching via live streaming sa ating YouTube channel ng TVUP, as well as sa Facebook page ng TVUP, ng UP System Facebook page, at ng Stop COVID Deaths Facebook page. Maayong udto po sa ating mga viewers from Cebu, at especially sa aking mga kamag-anak from Barili, Cebu. Kamusta na sa ating mga ka-Fridates? And thank you to everyone who always take the time to send us inspiring messages. It really warms our hearts and enlivens our spirit. Nakakatuwa basahin ang mga messages ninyo po. And as Doc Raymond has mentioned, we are missing the company of our Doc Susie today. Nakikiramay po ang buong pamilya natin sa Stop COVID Deaths at ang buong online community ng Stop COVID Deaths, sa alaala po ng mommy ni Doc Susie na si Mrs. Josefina Dineros Pineda, loving wife to the late Dr. Esteban Pineda. So going back to our topic sa program na to, Doc Raymond, just sa ibang tao na hindi alam, na expand na natin ang definition ng Stop COVID Deaths, kaya dengue ang pag-uusapan natin ngayon. Yung COVID acronym na siya, yung syempre, current COVID-19 problems pa rin. Yung O, other outbreaks. Yung V stands for viruses, I, infections, at D, disaster. So mas malawak na po yung pwede natin talakayin sa Stop COVID Deaths programs natin. So ngayon, ang Stop COVID Deaths natin ay nagle-level up na po we look at emerging health problems in the community while we keep an eye out for COVID-19 developments here in the Philippines and in the rest of the world. And since we know that you like to always be abreast of the latest news in health and medicine here and abroad, we have a new segment in the webinar called News Updates. So these are some of the stories that we're keeping an eye on and why they are relevant to you. Our first story, first news update is the latest announcement of vaccine manufacturer Moderna that there is a robust antibody response in their Omicron-specific booster. Early trials showed that the antibody response was 8 times greater at 1 month following a dose with a booster containing both the original mRNA 1273 vaccine and a new vaccine in development that specifically targets the Omicron variant. So this is a bivalent vaccine engineered to target 2 different antigens able to target the original Wuhan virus and the Omicron virus. Now, we know in the US, nag-rise po yung kanilang COVID cases due to the Omicron subvariants BA.4 and BA.5. And here in the Philippines, meron na tayong BA.5 at syempre ang BA.2.12. So why is this relevant? Well, the Moderna officials think that this new vaccine could potentially offer protection for 1 year. So over to you, Doc Raymond.
Thank you, AVP Rica. Very good news po dahil po medyo marami na po yung Omicron cases of Omicron variant and the subvariants po. And if this is true and we could scale it, yung pong pag-distribute at pagbibigay ng ganitong bakuna, mas may panlaban na po tayo sa COVID-19. My next news update naman po, may kinalaman naman po siya. There was a small cancer drug trial among rectal cancer patients. Ginawa po ito ng mga doktor sa New York City's Memorial Sloan Kettering Cancer Center. Binigyan po nila ng gamot na dostarlimab for 6 months yung pong mga pasyente na may rectal cancer. Ang resulta po, every single one of their tumors disappeared dahil po doon. Although, syempre, 18 lang po, 18 lang po yung ating mga trial participants. Nevertheless, it really proves that the treatment, may pong empirical evidence in terms of the treatment working. And a lot of scientists are saying that these kinds of results have never been seen in the history of cancer research. So, something to really look forward, especially for those who have maybe family history or meron pong genetic predisposition po sa rectal cancer. Very important po ito. And that's the latest from my side, AVP Rica.
All right, and that's the latest news update from Stop COVID Deaths. All right, so for today's webinar, we review dengue, a debilitating disease that we're all familiar with, but that we can be more effective in helping our citizens know more about when signs and symptoms require hospitalization, as the course of the disease is relatively predictable compared to other viral infections. What are the latest updates on dengue? What is the role that climate change plays in new and more aggressive behavior of the Aedes aegypti mosquito? So, all right, Doc Raymond, I think it's time that we listen to what the people on the ground are thinking.
Thank you, AVP Rica. And for those who are joining us for the very first time, we usually set our discussion into context by taking the pulse of the common person on the street po, no? Which we lovingly call person on the street videos, wherein we post questions sa kanila po, no? Para po sa webinar na ito, ang mga katanungan na itinanong po namin, ano po ang alam ninyo tungkol sa dengue? Meron po ba kayong kilala na nagka-dengue na at kailan kailangan isugod sa ospital ang taong may dengue? Please watch this.
Ang pagkakaalam ko sa dengue ay nanggagaling sa kagat ng lamok, agnatin, and may mga severe na mga pag tumagal, mas lumalala.
Para po sa akin, ang dengue ay napakadelikadong sakit na nakukuha sa lamok.
So ang dengue ay isang sakit na viral transmission siya mula sa mga female mosquito.
Nanggagaling ang mga lamok na to ay sa mga tubig na nakaimbak sa mga gulong or gulong na naiimbakan ng tubig ng ulan or kanal, gano'n.
Nagkaroon ako ng dengue fever. Ang pangit sa pakiramdam kasi nag-start yon ubo lang, ubo-ubo, sipon. Tapos bigla na lang akong nagkaroon ng lagnat na pawala-wala.
Yung anak ko na panganay, may lagnat na siya. Pero yung lagnat na parang ang tawag doon, may sinat, gano'n. Parang hindi nagbabago. Pag ganon, nilalagnat, gumagaling, nilalagnat. Tuwing hapon siya, nilalagnat. Umaga, okay. Ang findings, may tonsil siya. Tonsil lang po yung findings sa kanya. Di pa po siya kinukuha ng dugo. Umuwi po kami sa bahay. Sabi niya, obserbahan niyo muna kung patuloy-tuloy po yung lagnat niya, tsaka niyo po ibalik. Wala naman pong idea na dengue na yun. Tapos sumusuka na po siya. Hirap na hirap daw, sumasakit na po yung tiyan niya. Yung kalamnan po niya sumasakit na. Tapos yung mga kasukasuan, masakit na yung mga katawan niya. Sabi ko, ano po kaya yung ganun? Tapos binalik ko po sa pedya. Doon na po siya kinuha na ng dugo. Doon po nag-positive na may dengue po siya.
Ako, nagka-dengue ako dati nung college ako. Ilang araw din yata ako sa ospital, tapos umabot sa point na very low yung platelet count ko.
Medyo matagal ako sa hospital mga 2 to 3 weeks ata ako sa hospital dahil sa dengue fever. Nung time na yun, natatakot ako. Parang nung time na yun, marami ring namamatay ng mga kabataan dahil sa dengue.
Yung ate ko rin nagka-dengue, tsaka yung dalawa kong kapatid. Lahat kami nagka-dengue actually sa iba't ibang. At sa case ko, parang ilang araw na akong nanghihina, tapos may fever. So, nagpa-check agad ako, tapos ayun, na-confirm na may dengue. Tapos sa case ng ate ko, hindi siya agad pumunta. Pinagalitan siya ng doktor kasi dapat matagal na dapat siyang inadmit sa hospital.
Dali na kaagad sa kinauukulan, no? Kasi mas alam nila Mas alam nila yung kung ano yung tama or kung ano yung best, no? Para sa mga may sakit na ganun, no? Lagi lang mag-iingat. It's always better to trust our doctors and medical officials. May mga nakatiwangwang na tubig, itapon, 'di ba? Yun yung mga prevention is always better than cure.
Okay, so thank you very much, TVUP, for giving us the pulse of the people. Many times kasi, sinasabi, tagal-tagal na yung dengue na yan. Ang dami-dami ng anti-dengue campaigns. Di pa ba nila alam yan, no? Pero minsan hindi kasi trickle down to everyone yung information, no? As we've heard sa ating person on the street interview. Go ahead, Doc Raymond.
Thank you, AVP Rica, and thank you po sa ating TVUP team, production team for really just giving us a sense kung ano po yung naintindihan nila and also their personal experiences pagdating po sa sakit na ito. Just a little bit of housekeeping for all those who are asking. Certificates of attendance have already been given from webinar 1 to webinar 102. So if you have watched at least 50% of the webinar duration at hindi po kayo nakatanggap, please let us know by emailing stopcoviddeaths@up.edu.ph. I-check po namin ang aming mga records din po for you to be able to for us to be able to send out ang mga certificates of attendance. We are seeing po on the chat na meron pong mga at least for 98, meron po pong sa 102. Meron pa po kasing konting-konti na lang for webinar 102, but at least for the 101 webinars, kompleto na po ang send out. So just let us know po by emailing stopcoviddeaths@up.edu.ph.
Oo, parang isa nag-post kanina, sabi niya hindi pa niya natatanggap, pero yung name na nilagay niya na kung saan niya gusto yung name ng certificate ay iba. Siguro
Opo.
dapat yung name na pag-register ninyo sa webinar, yun yung pangalan kasi nalalabas sa sa certificate. So
Correct
dapat
po.
kompleto yung pangalan. No, Doc Raymond?
Yes
So
po,
okay.
yes po.
So let's proceed with the topic at hand for our webinar. We always make sure to invite the best of the best for us to
Oh,
learn all about
I think we
dengue.
have our fun quiz, AVP Rica.
Yes. So well, sige, before we delve into the webinar, I know everyone is excited about our fun quiz. No, so we have our cute intro. Let's look at our cute intro for our fun quiz.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Ang cute-cute ninyo
It's a little bit surreal seeing an animated version of yourself, pero thank you po. Thank you AVP Rica and thank you to TVUP po, no? Right now, we'll be asking those who are in the Zoom at least to look at your screens po for you to be able to see the 2 questions that we have for this webinar. And for those who are in Facebook and in YouTube, if you could open up your browsers, type in slido.com, click and enter and input the code 5405717. That's 5405717 for you to be able to participate in our fun quiz. Ang una po nating katanungan para po sa ating webinar for today, what is the incubation period of dengue fever? Is it 1 to 7 days? Tama po ba yan? Is it 8 to 12 days? Or is it 13 to 21 days? So parang isang linggo, magdadalawang linggo or magtatatlong linggo. Yun po ang mga choices natin. We'd like to greet those who are joining us from the LGU of Bayambang, Pangasinan, from Lucena MMG General Hospital in Lucena, Philippines, the Cebu City Medical Center in Cebu, Dr. Ricardo S. Provido Sr. Memorial District Hospital in Iloilo City, Dept Health and Nutrition Unit of Maasin City, Leyte, the Bureau of Fire Protection in Lamitan City, in Basilan. Meron din pong nanonood sa atin. Let me just read from Dialysis Geria po, no? Maraming salamat po sa inyo. Those who are joining us again from Paco, Manila, from Barangay 84, Pasay City. Meron din pong iba pa pong nanonood. We also see a few more messages for Dr. Susie and family. Thank you po sa mga nanonood all the way from sa norte po, sa La Union. Meron din pong mga nanonood from Porac, Pampanga, from Baguio City nanonood, from the New Sinai School and Colleges. So maraming salamat po sa inyong lahat. Question number 2. Ano po ba? What is the mosquito vector for dengue fever? Is it Anopheles albopictus? Is it Anopheles gambiae? Is it Aedes aegypti? Is it Asian tiger mosquito? Or is it marsh mosquito? Yun po ang ating mga insects. Well, actually mosquitoes po yan lahat. So yun po ang ating mga choices for this question. Pero alin po ba dito ang nagdadala ng dengue fever sa atin? I'd like to also greet those who are joining us from the Raja Isteri Pengiran Anak Saleha Hospital in Brunei, the Ministry of Health in Oman, Bangkok, Thailand, Kanto City in Vietnam, Doha, Qatar, University of Hail, Saudi Arabia, University of Fiji, Lautoka, Lunichi Ali University of Blida 2, Algeria, Chula Vista, and Port Hueneme, tama ba to? From California, from the UP Medical Alumni Society in America, from Burtonsville in Maryland, the Philippine Nurses Association from Edmonton, Alberta, Canada, and finally from St. Eustatius, Netherlands. So maraming salamat po.
Di ko rin alam paano pinopronounce yung port na yun.
Opo. So thank you po, no? Thank you po. We'll try to keep the poll po open for as long as possible, but right now po we'd like to move in kasi po to our webinar proper, just because we're really excited to hear from our expert panel speakers. AVP Rica?
Yes, our first speaker is a familiar face to our regular viewers, having been one of our speakers for our first episode in Season 4. Now she's a speaker for our first episode in Season 9. So please give a warm virtual welcome to Associate Professor with the Department of Microbiology from the College of Public Health in UP Manila, and a Clinical Associate Professor with the Division of Infectious Diseases from the Department of Medicine at the UP-Philippine General Hospital, Dr. EVALYN A. Rojas. Doc Eva.
Thank you very much, AVP Rica and Dr. Raymond. Let me just share my slide.
Okay.
Okay po. Okay na po, AVP.
Okay, go
Yes,
ahead.
ma'am. Go ahead po.
Thank you once again, and isang magandang hapon po sa ating lahat. Thank you to the organizers of the Stop COVID Deaths webinar series for this invitation. So it's my honor to be the first speaker for this webinar, particularly focusing on the public health problem of dengue in the Philippines. So these are my objectives. I'll be describing the state of the dengue globally and here in our country. I'll just mention the clinical manifestations and management of dengue, including the prevention and control measures, and discuss the program of the Department of Health to address the dengue problem in the country. So I've heard the ano ba yung kanina po, yung pulse ng tao, no? So we'll see which information are correct and which are not. So dengue is a viral disease that is spread by mosquitoes. So it's an arthropod-borne viral disease. So arthropod, specifically the mosquito. So it is common in tropical and subtropical parts of the world, including Africa, Southeast Asia, and South America. So there are around 100 million cases of COVID occurring every year. And according to the WHO, it is endemic in over 100 countries, including our country, the Philippines. So as you can see in this map, so Philippines is colored deep red or maroon, which indicates high presence of dengue in the country. So around 3.6 billion people, or 40% of the world's population, reside in dengue endemic areas. So it is estimated that around 500,000 people with severe dengue are hospitalized every year, with around 2.5% case fatality rate. But it was noted that there was a decline in the case fatality rate, so 28% from 2010 to 2016, and they attribute this to the significant improvement in the case management of dengue. But overall, around 400 million people can be infected or are infected with the dengue virus. And as I've said, 100 million people become ill with the disease. And around 21,000 deaths are attributed to dengue. So there's a report by Southeast Asian stating that there are high-risk nationals for contracting dengue. And take note that Philippines ranked first as the highest at risk for getting the dengue virus. So what are the reasons? So later on, I can discuss that. But this is the data. This figure shows the cumulative number of dengue morbidities here in our country from 2015 to 2021. So I've heard a while ago in the intro of Dr. Raymond that you can see in this figure that there was a notable decline in the number of dengue morbidities in 2020 and 2021 as compared to previous years. And we all know that pandemic might have affected this scenario. And as well as with dengue mortalities, it's the same situation. So there was a notable decrease in the number of dengue mortalities in 2020 and 2021. But in the recent Morbidity Week report of the Department of Health, so as of April 23, 2022, we can see that the dengue cases as of this time is almost the same with that of last year. So around 20,000 cases as of April 23, 2022. However, there was a note in the increase in the case fatality rate of 0.6. And take note also that in these regions I've highlighted, so you can see here that there are regions with red mark, it means that there was a significant increase in the number of cases as compared to last year. And as I've said, the case fatality rate increased to 0.6. So why am I reiterating the case fatality rate? Because part of the goal of the dengue program of the Department of Health is to maintain a case fatality rate of not more than 1%. And as you can see, in our country as of this time, CFR is approaching or is 0.6% already. And as of last year, so total number of dengue cases from January to December 2021 was 78,872 cases. But take note that as of January 2022, so first month of the year, the country reported already 26,000 cases of dengue. And the Department of Health reported that dengue cases have risen by 94% since the end of March, as compared to the last year's level. So we can see here that there were more than 11,000 cases of dengue as at the end of April, which is 94% higher than that of last 2021, which was only 5,000, more than 5,000 cases. And we've heard from the news that Cebu has reported more than 4,000 cases with 38 deaths. And as I've said, the CFR in Central Visayas in general is 0.8%. That's why the Department of Health they're not declaring outbreak yet, but they have this announcement that we have to watch out this closely, because the increasing number of cases of dengue in Central Visayas and in other provinces in that region is getting higher and higher. That's why they released these department memorandums entitled Reiteration of the Guidelines on Dengue Outbreak Preparedness and Response. So just last May 11, 2022. So just a background of the disease, So dengue, so it's a mosquito-borne viral infection. Specifically, the mosquito is named Aedes species. So kanina nakita ko sa pre-test nyo, So Aedes species, so there are two species, whether aegypti or albopictus. So it's distributed in tropical areas together with other vector-borne diseases like your chikungunya and Zika. And the manifestation of the dengue is wide. So it can be asymptomatic, or sometimes it can be as severe as dengue shock syndrome. So Aedes aegypti is distributed globally. And again, in this map, you can see that in our country, there are areas with red, So red indicates highest occurrence of Aedes aegypti. So meaning Aedes aegypti is present in our country, and thus it facilitates the transmission of the dengue virus causing dengue disease. So which may be explaining why we are at risk for getting the disease. So I've mentioned that dengue virus is the etiologic agent. So it's the one causing the disease. And there are 4 serotypes of the dengue virus. So dengue 1, 2, 3, and 4. But I want to highlight here the fact that infection with one virus serotype will give immunity to that particular serotype, but not to the other dengue virus serotypes. So what does that mean? So even if you had dengue 1 infection before, you can be immune to that, but you can still have the risk for getting dengue virus 2, 3, and 4, and even co-infections. So pwedeng mangyari na you have dengue 1 and 2 at the same time, or even dengue 1, 2, 3, and 4. So there were reports of co-infection outbreaks. So I just want to show here the mosquito. So ang salarin, the mosquito carrying the virus, the dengue virus. So I've mentioned that Aedes species is the mosquito, and it's the same mosquito carrying the other viruses, namely Zika, yellow fever, and chikungunya. So as opposed to the other mosquitoes carrying other protozoans like the Anopheles, carrying malaria and even other encephalitis. So this is the transmission. So paano ba natatransmit ang dengue virus? So the main mode of transmission is still human mosquito human cycle. As I've said, kung walang mosquito, there will be no dengue infection. We need the mosquito to transmit the virus from the infected person to another susceptible host. So as you can see in this life cycle, when the mosquito, Aedes species, whether Aegypti or albopictus, so feeds in infected dengue individual. Okay, so it will stay in the mosquito for around 8 to 10 days. So yung tinatawag nilang extrinsic incubation period. So after that time, it's now ready to inject the dengue virus to another susceptible host na pwedeng magkaroon ng dengue ulit. So once inside the body of this another individual, it will take 1 or 4 to 7 days, so around 1 week before you have the first manifestation. This is what they call as the intrinsic incubation period. Yan, nakita ko ulit sa pre-test nyo kanina. So meaning from the time na nakagat ng lamok up to the first manifestation, so it will usually take 1 week. And take note that one infected mosquito can infect many individuals, so not just one individual. So what are the common symptoms of dengue? So dengue virus has, dengue infection has the universal manifestation. So you have fever, headache, swollen glands, nausea, vomiting. Sometimes it's very difficult to differentiate it with other viral infection like yung Zika and chikungunya, and it's also vector-borne disease. But this table shows the main differences between these 3 vector-borne diseases. So pag fever, mas common siya with dengue and chikungunya, while the rash is more prominent in Zika, and arthralgia or yung joint pains or sakit sa kasukasuan is more emphasized in chikungunya as compared to dengue and Zika. But the dengue can, unlike the Zika and chikungunya, can progress and can be complicated, leading to severe dengue. So this slide shows the progression of the disease. So you can have dengue fever lang, but you can also have dengue with warning signs. So what are these warning signs? When you have abdominal pain, vomiting, bleeding, lethargy, and restlessness. So all of these are warning signs. And why is this important? Kasi ito po yung sinasabi nga nilang warning, which will give you signal that baka kailangan ng dalhin sa ospital ang pasyente when they manifest or when they complain of these symptoms, so that we prevent it from progressing to a severe dengue. So severe dengue, it's somehow more difficult to treat, and it will portend higher mortality as compared to just dengue fever and dengue with warning signs. So this is just a short review of the course of the disease. Kanina, sabi ni EVP Rica, it's very predictable, the course of dengue. No? So this is the usual natural course of the disease. So it starts with the febrile phase. So in the first 3 days of the disease, you have the manifestation of high-grade fever, headache, body pain, and rash. So usually, hindi pa gaanong pinapansin ito ng mga pasyente or ng mga magulang ng pasyente. But take note that if not properly addressed, it can also be complicated by dehydration, kasi nga kung high fever, or seizure, or electrolyte imbalance. But more than this, after this febrile phase comes the critical phase. Ito yung dapat bantayan, no? Because this is the time that you have the possibility of all of these complications. Kasi this is time wherein you have the plasma leakage, yung pathophysiology ng disease, you have the plasma leakage already. This is the time that the blood pressure of the patient can go down and can eventually go into shock if not properly addressed. So, but take note that not all patients will pass through the critical phase. Some patients will just have the dengue febrile phase and then proceed to the recovery. But nevertheless, there are some patients na meron talaga silang critical phase. That's why they need to be observed for 24 to 48 hours to avoid all of these complications, yung shock, bleeding, and even organ impairment. So last phase is the convalescent phase. Ito naman na yung towards the resolution of the disease. So you have the resolution of the hemorrhage and plasma leakage. The vital signs of the patient tend to stabilize already. And this is the time that you have the Herrmann's rash. No? So you always hear that with dengue patient, they usually manifest with Herrmann's rash. Ito po yung typical na Herrmann's rash for dengue. So medyo mapula and makati yan. And actually, Herman's rash is an indication that the patient is towards recovery already. So actually, good sign si Herman's rash. But nevertheless, pag nasa recovery phase na, there are possible complications if not properly addressed. So since this is the resolution of the hypotension already, so baka naman pag hindi na-control ang resuscitation, yung fluid management of the patient, it can lead to hypervolemia and even pulmonary edema. That's why even those in the recovery phase should still be watched out for and monitored. So this is just a list of the diagnostic tests that is available for dengue that can help the physicians in diagnosing dengue. So there is an antigen detection, antibody detection. So the gold standard for diagnosing dengue is through PCR, the RNA detection. And rarely we do viral isolation because it's very difficult. Not all facilities have the materials or technology for isolating the virus. So I think this will be further discussed by our next speaker, but these are the available diagnostic tests for dengue. So treatment, just like any other viral disease, the main mode of treatment is still supportive. No? So supportive meaning kung ano yung symptoms, we have to address that. So analgesics for pain or antipyretics for fever. But it is not recommended to give aspirin and NSAIDs to avoid further bleeding. No? So past complication of bleeding. But for more severe dengue, so there's a specific algorithm in the management of dengue, particularly those with dengue shock syndrome and even with those with hypotension or in shock. So there's a specific management, usually management inside the hospital. But more important, I want to emphasize here what are the prevention and control measures, no? So more of the public health approach for preventing getting the disease. So all of these, what you see in this slide, are preventive measures to avoid the breeding, okay, or the facilitating the growth of the vector, which is the mosquito. Kasi si mosquito, it can breed in stagnant water, stagnant even clean water. So we avoid having that situation. So make sure that there is no waste clogging in the drains. Yung mga tires, no, na narinig ko kanina, yung mga tires, dispose all unwanted tires, cans, or bottles. Yung mga flower pots or vases that can harbor water. So it should be clean every week. And then kung may mga water container naman, it's unavoidable that you really have kailangan mag-imbak ng tubig. So you can cover that and just make sure that the surroundings is clean. Aside from that, so vector control, we can protect ourselves naman against the mosquito bite by using insect repellent, okay, so wearing long covered clothing, securing window and door screens, and sometimes if available, you can use mosquito nets or kulambo or in air-conditioned rooms. So our Department of Health has this dengue prevention and control program, so composed of these 6 components. There is surveillance, case management. So take note that integrated vector management is an important component of the dengue program, prevention and control program. As I've said, kung walang lamok, wala rin pong dengue. So they also have this outbreak response, health promotion and advocacy, and even research. But as we all know, so with the announcement of a pandemic due to COVID-19, so that the world was changed, no? And even the dengue program of the Department of Health somehow modified. Okay, so they have this Dengue Get Out program, so against dengue amidst the COVID-19 pandemic. So this aims to expand and integrate the program to include the prevention and control of Aedes-borne viral diseases such as dengue, Zika, and chikungunya. So its vision is an Aedes-borne viral disease-free Philippines with a goal to reduce the disease burden of dengue and to contain and prevent transmission of chikungunya and Zika. So it has also the 4S against dengue. So they still follow this: search and destroy mosquito breeding places, self-protection, seek early consultation, no, particularly those with symptoms, and say yes to fogging if there is an impending outbreak. So what are the adaptive methods or techniques or strategies of the Department of Health for dengue control program during the COVID-19 pandemics? So they made use of the advisories to the Center of Health to guide information, to disseminate information. They also shifted to virtual program implementation for reviews with CHDs in order to discuss policy directions and operational strategies. They enhanced information, communication, and educational campaign materials using quad methods, so radio, TV, newspapers, and the internet. So some promising innovations and best practices. So they have this program enhancement on clinical management of dengue and rapid advice guidelines. They also have this AO on the guidelines for the establishment of dengue Center of Excellence in tertiary hospitals to provide and identify resources and even collaborate with CHED and develop standardized training programs, capacitation, and offer regular trainings. So what are the current priorities of the department for action? So there are 4. So coverage of services, including the dengue-related services in the Manual of Procedure of the Universal Healthcare Primary Care Service Package. So quality of care requires immediate and appropriate intervention. So making sure that the program has these diagnostic tests readily available at the primary care facilities. And furthermore, cases that need higher level of care shall be referred to the hospital. So referral system is in place. So integration and response, so ensuring continued guidelines in the management of surge capacity during dengue epidemic, which details the activation of health emergency command system. And last but definitely not the least, health financing. So improvement of the healthcare packages is an integral part of the development of the Universal Healthcare Act. So they have to review the dengue PhilHealthcare insurance benefit packages that would be undertaken in consideration to the shift of focus in primary healthcare. Okay, so just to summarize the current status of dengue in our country as of early part of the 2022, so we can see here that there was a notable decrease in the morbidity and mortality for the past 2020 to 2021, but a notable somehow increased because we're just talking of as of April 2022 here, and yet we see an increasing number of dengue cases, morbidity and mortality, and all the more increase in the case fatality rate. That's why DOH is calling out the attention also, and we have to focus on this in the provinces that reported increased number of dengue cases. So I think this is my last slide, and I just would like to thank the Disease Prevention and Control Bureau of the Department of Health and Dr. Maria Margarita M. Lota for sharing some of their resources to me in this presentation. Thank you.
Ayun, maraming salamat po, Dr. Eva. Well, it's really comprehensive and we learned a lot, especially on the public health problem of dengue. So, please stay on po so we could have you during our Q&A session. Just to remind everyone, we will be choosing po questions coming in from Zoom, in Facebook, and in YouTube po para po makita. And then sasalain po namin, titingnan po namin ano po ba yung mga questions na yon. For those in the Zoom, if your question is selected, you might receive a message from our production team inviting you to be part of the panel. Sana po paunlakan nyo po kami at tanggapin ang imbitasyon na yon. You'll be able to switch on your videos and ask your questions directly to our experts po. So we encourage everyone, if you have any questions that you are hankering to ask, put them in the Zoom Q&A box or in the comment section in the Stop COVID Deaths or TVUP Facebook pages or in the TVUP YouTube channel. So our second of 3 presenters po for today, may I introduce to you, bago po siya pero malaman po ang kanyang kanyang talk for today. She's a pediatric infectious disease practitioner from Cebu City. Please welcome to your screens, Dr. BELLE RANILE. Dr. BELLE?
Hello, good afternoon Dr. Raymond, and good afternoon po sa lahat ng mga nakikinig at nanonood ngayon. Thank you
Thank
very
you so
much
much
for
po.
this invitation.
Go ahead, ma'am.
Okay, let me share my screen.
So Dr. Bell is joining us from Cebu, Doc Raymond.
Yes,
Oh,
so
very
maayong
clear.
udto. Yes, maayong
Yun,
udto
okay.
sa tanan.
Okay,
Okay,
Dr.
so
Bell, go ahead po.
okay, thank you very much, and maayong udto. Good afternoon again. I am tasked. I was invited to give a short talk on dengue alert sa panahon ng pandemya and sharing to you the Cebu experience, especially the private and public hospitals here in Cebu, as well as outpatient management. So I have no disclosures to make. So this is the outline of my talk. We will discuss the epidemiology of dengue in Region 7, Cebu City, and local hospitals. I have chosen a few, and we will review, as Dr. Rojas already made it very extensive review of dengue, so I don't think I have to dwell longer on this. But we will talk also about outpatient management and monitoring and dengue control and prevention. So dengue is a vector-borne disease, endemic in 100 countries. And as Dr. Rojas mentioned, there are 4 serotypes. And the primary infection usually produces a non-severe or asymptomatic infection. However, a secondary infection may cause severe dengue. And I know that you are familiar with the term antibody-dependent enhancement. So this is the possible cause of a more severe secondary infection with another serotype of dengue. No treatment is available, but it can be early managed. And these are the number of 5-year average cases in the Philippines with a 5-year average CFR or case fatality rate of 0.39. And the ideal should be below 1 or even below 0.5. So this news article came up about few days ago, and it is we were not shocked because this is expected with the increased mobility of the society and with the recent rainfall, plus the history of, there was a major typhoon in Cebu. We had Odette, and eventually we also had Agaton. So it was expected that dengue cases would rise. The pandemic, at the beginning of the pandemic, we all know that it has caused unprecedented disruption to society, and it indirectly affects the infectious dynamics of infectious diseases. So during the pandemic, we've had decreased number of dengue cases and even other infectious diseases. But as mobility increases, we expect more of these infections to resurface. So this just shows you the number of COVID cases in the region, Region 7 from January to May. And after the surge of Omicron in January, there was already a significant drop of our cases of COVID. In fact, our daily average number of cases is only about 5, I think. However, you see here that down with COVID, but there is an increase in the number of dengue cases in the region in the same months, January to May. In fact, as of May 28, there are a number of 4,623 cases with 38 deaths and a case fatality ratio of 0.8. So there was an increase in the CFR. And this accounts for 431% more cases than in 2021. So this just shows you the comparison, the number of cases in 2021 in the red line and the blue bar showing the cases in 2022. Here, another news article that the Cebu City, which is the number 1 city affected in Region 7 with regards to number of cases, reported in May 19, 700 cases with 11 deaths. Another city in Cebu is Mandaue, which is also number 2 in the number of cases, number 2 or number 3, I think. And they attributed it to the fear of COVID, which led parents to have late health-seeking behaviors or late checkup of their patients, according to our CHD chief. These are the number of the top 20 municipalities with dengue cases and deaths for Region 7 from January to May 28. And number 1 here is Cebu City. Cebu City. So this is Region 7. And here is Cebu City and the neighboring Mactan or Lapu-Lapu City. Just to show you the age and gender distribution of the cases in Region 7, there is no significant difference between males and females. However, take note that majority of the cases belong to the 6 to 10 years old, or in total, the 1 to 10 years old. This will also show to you the number of dengue admissions in 4 private hospitals in Cebu City from January to May 2022. And in comparison, the blue line here shows to you the number of cases in April. In comparison, there is a huge jump in the number of admissions in these 4 private hospitals in 2022. In fact, there were already 370 admissions with 1 death and a CFR of 0.27. Here, we have data from 2 government hospitals in the city from January to May 2022, and you see here a rising number of cases as well. Total admissions from January to May is 344 with 1 death or a CFR of 0.3%. So just the same, no? Comparable with the CFR in the 4 private hospitals. This is another graph showing to you data from 1 selected private institution in the city. And this one not only covers the admissions for the duration of 5 months, but it also included consultations. And you see here that there is a increase in the number of cases seen at the OPD as well as in admissions. And the majority of the cases were patients with dengue with warning signs. So for this hospital, there are a total of 130 cases, and 93 or 71.5% of these cases were in fact admitted. So there is an increase in the admission rate. However, luckily, unlike during the past surge of COVID, our health system is not that crippled, no, this time compared to the previous year in the pandemic. Here in the same hospital, showing to you the number of dengue cases according to gender and age. And just the same as the previous data, the highest number of cases belong to the 6 to 10 years old. Also in this data, this time from the city, no, not the region, but Cebu City, it also shows to you that majority of the cases are in the pediatric age group. In fact, it consisted about 47%. So in other words, the mosquitoes might be really are more attracted to children. No? I have read that increased mobility can cause mosquitoes to be attracted more because of the emission of CO2, and perhaps also other sensory cues which are make them more attractive, make children more attractive to mosquitoes, and a lot of other factors as well. This now summarizes the number of dengue cases per month and the total deaths from 2018 up to 2022. And we are still in the middle of the year. We already have a total of 946 cases. So this is not only admissions, but also consultations in the city. And deaths of 16 with a case fatality rate of about 1.5. So we already reached the 1, no? Which is the parang, it should be less than 1. So we've way past the that CFR. comparing the dengue cases in the last decade, for Cebu City, we've had dengue outbreaks in 2012 and 2016, as well as also, I think also in 2018. And we are here now for 2022. This is interesting data from the Cebu City Health Department showing to you the fatalities or the dengue deaths from January to May 31. Take note that most of them most of them expired almost on the same day that they were admitted. So this just reflects that late health-seeking behaviors is a major factor in the midst of these patients. And our society, our city is working hard to correct those behaviors. So just a review again for your quiz. The mosquito vector is Aedes aegypti. This is the main vector, although as previously mentioned, Aedes albopictus can also be a dengue vector, and it prefers high humidity and temperature. That's why climate change may have a role in the increase of dengue cases also worldwide. And it is spread through the bite of a female mosquito. This was already shown earlier. I just want to emphasize that for dengue with warning signs, we pediatricians have an acronym for it for easy recall. And we use A, B, C, D, V, and triple L. A is for abdominal pain. B is for bleeding. C is for clinical fluid accumulation, which may be seen as edema, ascites, or pleural effusion. D is not included here, but it's decreased urine output. V is persistent vomiting, or more than 3 episodes in 24 hours. And we have your 3 Ls, which stands for lethargy, or restlessness, liver enlargement of more than 2 cm, and your laboratory, which primarily shows increase in hematocrit with concurrent rapid decrease in your platelet count. So take note of these warning signs. So it has been discussed earlier, the clinical course of dengue, the incubation period. The correct answer is 1 to 7 days. However, that was from our Nelson's textbook in pediatrics. In other textbooks or even in CDC, it can be as long as 3 to 10 days or even up to 14 days. And then you have your febrile phase or your period of viremia, followed by your critical phase, 1 to 2 days, and your recovery phase. So for the febrile phase, what we usually look out for are signs of dehydration. And these are the clinical signs and symptoms that are common during the febrile phase. The usual duration of fever in dengue is 1 to 7 days or 2 to 7 days. So beyond that, you would want to think of other causes already if the fever is more than 1 week already. Followed by the critical phase. The critical phase usually starts about the 3rd to the 7th day, and it is heralded by the drop in your temperature or effervescence. However, dengue can also be a biphasic fever. That's why it can have a slight rise around this day to about 37.5 to 38 degrees Celsius before the recovery phase. So the critical phase is what we should really watch out for. Majority of the patients don't really go into the critical phase. In one literature, they said 1 out of 20 dengue patients, or about 5%, may go into critical phase. And this is the period where there is increased plasma leakage. There could be signs of shock, bleeding, and organ impairment. And your clues will be a rapid rise in your hematocrit with a drop in your platelet. And then you have now the recovery phase. So this slide just shows you the different rashes of dengue. This one is what you call Herman's rash. described as islets of white in a sea of red. And when you see this, you won't forget it. No? It usually heralds that your patient is going now into your recovery phase. It can be really pruritic though. Other lesions aside from your islets of white and a sea of red could be your maculopapular lesions and your petechial lesions, especially with the low platelet count. But it has been said that only about 70% of your dengue patients will have a rash. About 30 of them will not have a rash, although it's also common to see them having facial flushing during the early part of the febrile phase. So how do we diagnose? Aside from your clinical signs and symptoms, you get your CBC, and if the patient needs to be admitted, you also get your RT-PCR. So what Dr. already mentioned about the virological isolation, you have your viral and your RT-PCR, but what is readily available in our setting is your NS1 antigen, which usually rises during the first 4 days, which coincides with the period of viremia. And after which, what follows is your IgM about the 5th to the 8th day, and then it also goes down later, about 4 to 6 weeks, and also followed by your IgG. This paper just shows you that your dengue and your COVID-19 antibody rapid diagnostic tests can have cross-reactivity. So this is a paper in Indonesia by Dr. Marcia Santoso and company, and it says that there is still high specificity across all COVID-19 rapid diagnostic test brands because they tested 5 different brands against your dengue confirmed samples, ranging from 98.3 to 100%. However, there could be a 6.3% COVID IgG positive samples who will cross-react with your dengue, and at 21.1% of your COVID IgM positive samples, which will cross-react with your dengue IgG. And this is the result of their study. So despite the high specificity of your COVID-19 rapid diagnostic tests, cross-reactions and false positive results can still occur. Though we've also seen patients who have dengue and COVID-19 co-infection. And according to our Salvacion study, which is from PEDSP, the surveillance and analysis of children with COVID nationwide, the co-infection rate for dengue and COVID is about 4.4%, according to the latest data that they have released. So now let's go to outpatient management. So in order to, you have already diagnosed your patient as dengue. Now you would want to ask is, what phase of dengue is my patient? Is she in the febrile phase, in the critical phase, or in the recovery phase? And what is the state of hydration of my patient? Are the vital signs stable? So are there also warning signs? So if your answer is no to, if your patient is well and without any warning signs, you can classify your patient as the treatment management as Group A. So these patients who are able to tolerate adequate volumes of oral fluid, pass urine every 4 to 6 hours, do not have any warning signs, particularly during the afebrile or the critical phase, and have stable hematocrit and hemodynamic status without coexisting conditions. So what are these coexisting conditions? Pregnancy, infants, or even with diabetes and other renal problems. If the patient does not have those coexisting conditions, then you can send the patient home, but with instructions, okay? And close follow-up. So if you send the patient home, you should always give anticipatory guidance, follow up daily, and it's also recommended to do a serial CBC and identify warning signs. So we should educate our mothers regarding this. So for dengue management, outpatient is done for Group A patients, those without warning signs and no coexisting conditions. Send home the patient with anticipatory guidance and advice monitoring. However, if your patient has dengue warning signs, you should always refer this patient for in-hospital management. This is also advice for those patients without warning signs, but with coexisting conditions, as mentioned, and also in those who are living alone, perhaps, or are living far from the healthcare facility. However, for Group C treatment, for patients with severe dengue, these patients should be referred urgently to an emergency department. So this has been discussed also, the strategies, the 4S strategies of the DOH in dengue control and prevention. And aside from that, there are surveillance for dengue in Central Visayas starting last April with the rise in the dengue cases. Our RESU, our DOH-7, has released a memo or guidelines on the collection of blood for dengue surveillance. So it should be, the patient should fit the case definition for dengue, whether suspect, probable, or confirmed, and the serum should be taken within the first 5 days from the onset of illness and sent to our RESU 7 for transport to RITM for serotyping. Another strategy in dengue control is your case management and diagnosis. I would like just to share with you that in our PPS, Central Visayas, our leaders have they have what you call your dengue caravan, which instructs healthcare workers, barangay healthcare workers, midwives in different locations in the region, and they were very active since 2018. So this has made a big impact to in the education of our healthcare workers, so that our patients, when they get referred to the city or the hospitals from different suburbs or districts, they are well managed already. And also you have your vector management, as well as outbreak response, health promotion and advocacy, and also research. So this is just to show you a few pictures that our City Health Department has done to address this alert level of dengue cases. And our next speaker will be the one to expound more on this. So these are just cleanup drives, lectures, training of the dengue brigade, and also your 4 o'clock habit, and even your misting and cleaning up, and also application of larvicides. Okay, so in summary, dengue virus infection is responsible for the most significant mosquito-borne viral disease and continues to be a major public health concern. Rising number of cases is influenced by rainfall, climate change, temperature, urbanization, and distribution of the principal mosquito vector. What is vital in reduction of burden of disease is early, prompt, and rapid screening, prompt recognition, and appropriate management and prevention strategies. And community participation is key in the control of dengue. So a few acknowledgements for our Cebu City Health Department, RESU 7, and a few friends who helped me in one way or another in the preparation of these slides. Thank you very much.
Thank you very much, Doc Bell, for sharing with us your experience in the different hospitals where you practice in Cebu City, most especially the treatment of dengue, including outpatient management, monitoring, and labs. Please stay on for the Q&A session. And that's all. Umuulan tayo ng mga applause and ng mga heart sa ating Zoom. So let me introduce our last speaker. He is the division head of the Cebu City Health Department and the former dengue coordinator of the CCHD. Please give a warm welcome to Dr. ZELIG Javier. Dr. ZELIG.
Hello po,
Hi.
good morning. Oh,
Sige
good
po.
afternoon. Medyo na-tense.
Okay lang. Sige po, let's try sharing your slide po.
Okay. Okay. Sige, I'm Dr. ZELIG Javier. I am currently the head of the Environmental and Occupational Health and Sanitation Division, and currently the program coordinator of the environmental health programs and former program coordinator for the dengue prevention and control program, currently filling in for Dr. Remedyo because he is busy coordinating with our community leaders, especially with the barangay captains, in mobilizing our dengue brigades to address this rise in dengue cases. So I am invited to discuss public health measures in addressing dengue in Cebu City. So continue for a while. For legal purposes, the department is using the DOH guided program on implementing dengue prevention and control activity, though there are other invaluable references from other organizations such as WHO, CDC, and the PAHO, or Pan American Health Organization. These references would only meant to improve interventions set by the Department of Health. Key program strategies of the program: 1. Early case diagnosis, management, and referral to higher facility. 2. Integrated vector management. 3. Effective surveillance systems utilizing the Philippine Integrated Disease Surveillance and Response System. For early case diagnosis, management, and referral, activities that have been done at the community level are active surveillance, which is done by the BHW, or our barangay health worker, through house-to-house visits, assessing family members for fever, CBC, dengue NS1 rapid diagnostic test, and routine follow-up for Group A patients are also being done. Patients found to have warning signs are automatically referred to higher facility. This also includes infants, neonates, elderlies, patients with comorbidities, patients living alone, and patients with poor access to transportation or are living far from health facilities. The image you see in the slide portrays one strategy among others conducting case mapping of dengue cases in our locality. Integrated vector management comprises entomology survey, larvicidal activity, ultra-low volume misting, curtain chemical impregnation, and distribution or installation of insecticide-treated nets. Entomology survey is part of the surveillance process wherein we determine the strain of larvae existing in the perimeter of the index case. This allows us to determine the dengue carrying vector is a habitant in the area, or if the case is a migrant where the entomology survey is negative for the Aedes strain. Larvicidal activity is done to inhibit the development of larvae to adult mosquito. Implementing or utilization of the ultra-low volume misting, which is done in areas where adult mosquitoes are present. The mist suspends in the air for a time period and allows the chemical to stick to the wings of the adult mosquito and eventually kill them. Curtain chemical impregnation done alternatively in houses where insecticide-treated nets cannot be installed. Installation of insecticide-treated nets has been done in public schools to prevent dengue infection. The picture documentation shows that larvicidal activity. There are two types of larvicides being used in our locality. These are the granules and the chemical solutions. These are usually applied in area containing water with larvae that are difficult to drain. The picture in the left, you see our inspector putting a larvicides in a drum full of water. Although the drum can be drained easily, but the household ano to na kanang ask permission from us that hindi muna ma-drain yung tubig kasi yun lang yung water source nila sa locality na yan. Utilization of ultra-low volume misting is done during onsets of outbreak or spikes of cases, done in 4 cycles with 7 days apart from each cycle, and can be done twice or thrice a year if needed. Also, this is done during the early hours of the day, during when mosquitoes are on their active stages during 6 a.m. to 8 a.m. in the morning. Curtain chemical impregnation, done for each household by immersing curtains in chemicals or insecticides, then air dried. Effective chemical impregnation can last 5 to 6 months. Sun exposure can lessen the effectivity or render the chemical ineffective. Installation of insecticide-treated nets found to be very effective in some studies to lessen cases of dengue. Validity for these chemical treated nets is 3 to 5 years. These nets are readily provided by the Department of Health. Effective surveillance system utilizing the Philippine Integrated Disease Surveillance and Response System. It is a system that is utilized nationwide and monitors 25 diseases and syndromes that have potential to cause an outbreak and that warrant an immediate response. The system categorizes the diseases into 3 categories. 1, epidemic-prone diseases. Second is the diseases targeted for eradication. And third category is other diseases and conditions of public health importance. Dengue, on the other hand, is found under epidemic-prone category. Other anti-dengue activity is, which was discussed earlier, is the continued implementation of the Department of Health's 4S strategy, which is the search and destroy, self-protection, seeking early consultation, supporting misting during outbreaks. I would just like to note that we differ from the conducting of fogging activity because it has been banned by the DNR. Search and destroy activity includes entomology survey and environmental cleanup. Other anti-dengue activity is health education through community organizing and capacity building. As you can see, our dengue coordinator at that far left picture, Dr. Remedyo, is conducting community organization and reorientation of healthcare workers and other personnels that can be utilized for improving the anti-dengue intervention. Over the past decade, I believe this was shown a while ago, over the past decade, there has been more cases accounted than of the year 2022. The graph shows the decline of dengue cases during the pandemic period due to lockdowns, home quarantines, isolations, and limited movement of community, thereby decreasing exposure to environmental-related diseases, especially to the dengue vector. During the pandemic period, there has been limitations in implementing the dengue prevention control program due to realignment of personnel to address COVID-19 situations, limited fever surveillance, limited face-to-face consultations, delayed health-seeking behaviors of the community. Fortunately, community quarantine played a role in the decrease of cases. To address these issues, the department continued anti-dengue activity while maintaining minimum health protocol. This graph shows, though there is an evident rise of cases of dengue this year, but strengthened anti-dengue activity through intensifying 4S strategy, integrated vector management, health education, and inter- and intra-sectoral actions and collaborations, especially in the barangay level, shows a starting decline of cases last May. My recommendations is strengthen the implementation of dengue prevention and control program while maintaining minimum health standards. implement targeted indoor residual spraying, target residual spraying. This is a new strategy introduced by the DOH, which has been done in eliminating malaria endemic areas. I believe this intervention is beneficial or as effective, if not more effective, than the ultra-low volume misting, because this intervention targets the resting places of adult mosquitoes, such as behind furnitures, cabinets, under the tables and chairs, behind appliances, under the sinks, and behind toilets. Other benefits of this intervention is that it cannot be washed out by the rain as opposed to the ultra low volume misting, which is being done outside of the house. In conclusion, dengue intervention can be unhampered by the COVID-19 situation. It has been shown that we can continue the program despite the pandemic by maintaining minimum health protocols. Increase in death rate is attributed to poor health-seeking behavior in the community because the thing we noticed here in Cebu, when patients or in the community, when people presents fever, they attribute it to COVID, and they are afraid that they will be locked down or isolated. So tendency is they won't seek consultation because of the fear of being quarantined. So this practice relates to the increase of death rate in the city. The community as well as policymakers plays a vital role in eradicating this disease. I think that's my slide. Thank you.
Well, thank you very much, Doc ZELIG, for sharing with us the public health measures being undertaken in Cebu City, including the challenges that you face in the program implementation. So at this point, wow, and at this point, may we ask our panel, everyone, to please switch on your videos so we can begin our Q&A session. So please stay on, Doc ZELIG, and may we ask Doc Eva and Doc Bell to please join us. Yes, and before we go into our Q&A session, let's just take a quick break for a special public service announcement today.
O sige na anak, parang kagat lang ng langgam. Kantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ka rin po ang color nito. Pero ayoko po ng red huntik. Masakit kumagat at takot rin po ako sa blood. Magtutugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo, okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love.
Thank you, Doc. Thank you, Nay.
Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Okay, so the COVID Communication PSA is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18 years old. We hope that you can share this message to all parents, guardians, and carers of our children so that they will also be protected against COVID-19. This PSA is our continuing commitment to push for COVID-19 vaccination and all kinds of vaccines for everyone who is eligible. So mga bata, magpabakuna na kayo. Doc Raymond?
Thank you so much, AVP Rica. So, alam ko po, nagtatanong po kayo, no, how to share this on our social media networks. Nandun lang po siya sa ating, if you go to the YouTube channel of TVUP, you'll be able to see ito pong ating, very, very cute videos po for vaccination. Also, we understand that everybody very, very busy po, no? And we have selected presentations that will feature po yung mga very, very short na consumables that we lovingly call as SCD Shorts. Again, if you go to youtube.com/TVUP-PH, you'll be able to see all of our our SCD Shorts po to date. And to start the ball rolling for our panel discussion po, no, let me just ask this question. And this is something po that people have been asking with regards to pagdating po sa dengue. I'll post this to Dr. Eva. Ma'am Eva, ang ano po ang ano natin, ang update or what can you share to our audience with regards to our dengue vaccine? Kasi yun po talaga ang ating katanungan na medyo mainit-init po Dr. Eva.
So, sorry, nakamute pala. Thank you, Dr. Raymond. So far, to date, wala pa rin pong available na dengue vaccine in the country. However, in other countries, there are dengue vaccine given to the general public already. But so far po sa ating bansa, wala pa pong available. There are ongoing clinical trials, vaccine trials for dengue also. Pero to date, wala pa po sa market.
Thank you, Dr. Eva. So, ma'am, yung ano po, yung with regards to I think we were able to touch on the strains of the vaccine po, no? So, meron po dito from Ricardo Isidro, nagkaroon daw po siya ng hemorrhagic fever in the 70s. Posible daw po ba na magkaroon daw siya ng 3 strain nung dengue po?
Sige po. Yes po. Ako personally, I've seen patients who had the 4 dengue serotypes, unfortunately, but survived naman. So that's possible po. As I've said, yung infection to one serotype will give you immunity to that, but you still have the risk of getting the other strains.
Oh, okay.
Thank you po.
So,
go ahead, Ibiriga.
wala yata si Doc Raymond. Are you there? Meron lang tayong mga comments na basahin ko na ibang comments sa ating chat box. Si Cherry is sharing na throwback daw, more than 5 years ago sa Region 3, sinashare lang niya na Region 3 was ravaged by dengue and Tarlac hospitals were full. And she was a happy survivor from the community who suffered. So thank you, Cherry, for sharing that. At may nabasa din ako dito, saan ba yun nawala na, pero share niya yung buong pamilya niya nagka-dengue. Ayan, sabi si Benilda de Gula, sabi niya, thank you po to all speakers, nice to hear updates on dengue. Siya daw po, problem natin yung disease na yan. Most of my family had it and it's really hard to control vector-borne diseases kasi po hard to control environmental factor. Yan. Okay, Doc Raymond, are you still with us? Siguro I'll start asking some of the questions na lang on our Q&A. No, ay kanina po.
Sige, go ahead, AVP Rica.
Oo. May nagtatanong dito. Well, kanina Doc ZELIG, nabanggit niyo po yung yung ultra low volume misting. So hindi na po pwede yung foggy ngayon. Ganun po ba yan? Paki-unmute po.
Sorry. Wala na po. Hindi na tayo ina-allow ng DNR na magka-conduct ng fogging kasi it's environmentally harmful, and also according to DOH, the fogging machine utilizes fuel which promotes risk for burn. Yun po.
Okay, salamat. Doc Raymond, do you have any questions you want to put up?
Yes po. This one is the most upvoted po, no, of all the questions that we have. This question po comes in from Anna Pauline. We'll post it to Dr. Bell. There is a relative increase of dengue cases compared to 2021. Have we looked at the possibility that there might just be marked underreporting of dengue in 2021 due to COVID? Or is it more likely na ito po ay totoong outbreak due to the effect of climate change on the vectors? Dr. Bell?
Yes, thank you for that question. Actually, I conferred with our one of our officers at the City Health with regards to this one. And as we can recall, it was during this time that there was a Delta surge, no? So a lot of the patients were afraid to go to the hospitals, were afraid to seek consultation. So it really is a possibility that this is due to underreporting. We cannot rule this out. That's true. Thank you po.
Doc Eva, yung kayo acronym nyo kanina, yung ABCD, si Doc Bell pa yun, yung ABCDV triple L. Ano po yung D ulit?
Decrease urine output. Decrease urine output.
Okay. Bakit po kasama? Paano namin i-measure yun?
Dapat po kasi may urine output tayo every 4 to 6 hours. So especially in pediatrics, pag hindi po umiihi yung bata, or pag hindi napansin na nahalo sa diaper, that's an important parameter to assess hydration po. Pag hindi siya umiihi. And that's a warning sign.
Oo nga, parang may nagtatanong rin, paano namin alam kung kailan na dapat isugod sa ospital?
Yun.
Pag nagdudugo na ba, yun na ba? Yung nose bleeding or something?
Opo.
Paano po malalaman, Doc Bell and Doc Eva?
Okay, so as I've mentioned in the lecture, pag meron po ng mga warning signs, yun po ay indication to seek consultation. Or better yet, mas maganda kung earlier. So before the onset of warning signs, for example, magto 2 days na yung fever niya, and we cannot really rule out what cause or could it be possibly dengue, it's best to seek consultation na po. Wag na pong magtagal.
Okay.
Thank
Kasi
you po.
I remember dati na nagkaroon tayo ng dengue outbreak, madami ako nare-receive ng mga messages na nag-appeal for blood donation, no? Yung kailangan ng blood transfusion. May nakita akong question dyan, Doc Raymond, about blood transfusion.
Opo. Sige po. This one comes from Victor Emmanuel Gabriel. Kailan daw po ba nagbibigay ng platelet transfusion, Dr. Bell?
Usually po, we are now more conservative with regards platelet transfusion. So in pediatrics, we give it if the platelet count is below 10,000 and there is significant bleeding po. So kung stable naman yung patient, there is really no need to give platelet transfusion. Thank you po.
Yes po. So add ko
Go ahead, Ma'am Eva.
So agree po with Doc Bell, no? So there's no strict guideline that at this platelet count level, so you have to give the transfusion kasi different patient presents differently also. So it depends on the clinical presentation because there are some patients with still acceptable platelet count level, pero if they are clinically bleeding or unstable that warrants transfusion, then you can give it. But there are some naman as low as EVP as low as 10, no, na platelet, pero kung clinically stable and can still monitor, pwedeng hindi mag-transfuse. So it depends on the patient.
Okay, I think Doc Raymond, it's time now we look at our Zoom and Slido results, no? Our fun quiz.
Sorry,
may one
nakamute po
question
pala ako.
pa.
Although I have one more question po kasi that we really would want to pose and I hope you'll oblige me po for Dr. Eva. Ma'am Eva, di ba may mga places po talaga in the Philippines that malaria is endemic, tapos meron din naman yung mga dengue. So we receive po kasi 3 questions regarding this. how would you know that ito po ay malaria at ito po ay dengue? And then, what's the difference daw po in terms of management in that sense, ma'am?
So in terms of malaria and dengue, so unlike si dengue, chikungunya, Zika, mas more common, si malaria will somehow have a different set of manifestations that you can differentiate from dengue, no? So of course, aside from the clinical presentation, you have the laboratory tests that will support the diagnosis of either the dengue and malaria. And it's important mo na ma-diagnose whether it's dengue or malaria kasi magkaiba po ang management. So there is a separate drug that can be given for malaria, and then sa dengue wala kasi. So sa malaria, meron pong anti-malarial drug. So it's very important for it to be diagnosed early, and then so that it can be managed appropriately.
Thank you so much, Dr. Eva. And then can we have, okay po. Can we have, ito po, we have 2 questions. The first question, nasagot na po ito ni Ma'am Eva, pero we'll ask her to answer again. First question, incubation period of dengue fever. Ano po ang tamang kasagutan, Ma'am Eva?
Yes po. So tama naman si 71%. So as said by Dr. Bell din kanina, so around range of 4 to 7 days, but sometimes pwedeng maging as long as 14 days. But usually 1 week po ang incubation period.
Yeah, so tama si Doc Eva, 71% ang sumagot niyan sa Zoom at 90% naman po ang tama sa ating Slido. Go ahead, Doc Raymond.
Thank you po. And then for our second question, I'll ask Dr. ZELIG to answer this. Dr. ZELIG, what's the mosquito vector for dengue fever dito po sa aming 5 pala na nilistang mga lamok, sir?
Yes po, thank you for the question. Yes, yung pinaka-common na dengue vector dito sa atin is yung Aedes aegypti. Minsan lang yung nakikita na nagdadala ng dengue yung Anopheles albopictus. Yes po, tama yung mga sagot nila.
Ayun, thank you so much. So medyo karamihan naman po ng sumagot, at least for Slido at dito rin po sa ating Zoom question. 79% po sa Zoom at 88% naman po sa Slido ang sumagot po ng tama na ito po ay Aedes aegypti. So but before we really end our Q&A session po, no, we want to be able to prepare our expert panelists po who really took the time to share their insights and answer questions po with regards to dengue. Ano po ba yung inyong mga parting words for each of you, and then AVP Rica will be the one to call on you po. But before that, we will be asking everyone to answer po ito pong ating evaluation poll. The one that you are seeing on the screen shows po a 5 question evaluation poll. It's a 4-point Likert scale for each. And first question reads, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, panelists used appropriate language with technical medical jargons adequately explained. And 5, panelists contributed to new perspectives and knowledge on managing various key health issues. So, again, ulitin lang po namin, wala po kaming hiwalay na sinishare po na link with regards to the evaluation poll. Ito na po iyon. We hope you'll be able to join in putting in your feedback for our panelists po, no? Strongly agree, disagree, and strongly disagree. We will not be closing this evaluation poll po, no? And we hope you'll be able to answer and put in your inputs po. As AVP Rica calls on our panelists for their parting words.
Okay, so before we end our Q&A session, may we ask for the parting words from each of our panel for our viewers. Let us start with Dr. ZELIG Javier. Doc ZELIG.
Yes po. Parting words. Hindi ako naka-prepare. Pero ito na lang. I'll try to speak simply, no? For the listeners. It is a call to action now for the rising of dengue cases. The health sector cannot do this alone. The community has a very big role to play. Kumbaga sa isite ko yung sinabi ni Dr. Suy, one of the program coordinators at DOH way back 4 years ago. He has been handling a community for 20 years, but then the dengue disease has not been eradicated in that place. So he cited that the community, no matter what we do, the community has a very big role to play in this fight against dengue disease. So yun lang po. So sana ma-empower yung mga tao na maglinis ng kanilang paligid. Yun lang.
Okay, maraming salamat, Dr. ZELIG JAVIER. May we now turn to Dr. BELLE M. RANILE.
Thank you po. Siguro we have survived the pandemic for the past 2 years. So we should not be complacent naman to protect ourselves against other infectious diseases, including dengue. So siguro, since we don't have a vaccine yet, aside from our minimum public health standards, our non-pharmacological interventions or NPIs, idagdag na rin natin yung 4S. So, siguro educate our patients, our barangay health workers, and vaccinate, no, kung for the vaccine preventable diseases, and also lastly, collaborate kasi hindi natin kayang sugpuin ang dengue without collaboration. Yun lang. Thank you very much.
Thank you. Just to summarize, reiterate yung 4S is search and destroy, self-protection, seek early consultation, and support misting. Kasi hindi na pwede yung fogging. Okay, and finally, let's hear from Dr. EVALYN Rojas.
Yes po, thank you, AVP. So just like what the other panelists have said, so Dr. Zelig and Dr. Bell, so we've been in the pandemic, so not yet end, no? So andyan pa rin pong pandemya, and dengue, even before COVID-19 is there. So actually, Philippines is said to be hyper-endemic with dengue already, as shown by the cases even before and up to now. So we should be aware of the manifestations, the risk factors of getting dengue, and when to consult so that you'll have it will be properly managed and on time. And also, don't forget that there are available for prevention and control measures, actually easily that can be done, prevention and control measures. Kung susundin lang po natin at gagawin ito and susupuin ang lamok, lamok ang pinag-iinitan talaga because there's no dengue when there's no mosquito, then we can fight this dengue. But as said, very difficult to do it alone, so we need to collaborate and we have to work with the community. So thank you, UDP.
Thank you, Dr. Raymond. I think we're going to share na our panel evaluation poll results.
Yes po, maraming salamat po sa for Dr. Zelig, Dr. Bell, and Dr. Eva, really for your comprehensive presentation. Very informative po ang inyong mga binigay on the topic of dengue, lalo na po na we're still in a pandemic. As you can see on your screens po, no, so at least 94% po pataas ang mga nagsabi na strongly agree po sila sa really on how the webinar was conducted and all of the information na kanilang nakuha at least for this webinar. So maraming salamat po sa inyo. And we really hope that this is something that we could continue to provide, especially for those na first time lang po na sumali sa ating webinar for today. So we really would give appreciation po to our guest speakers who have made the time in their very hectic schedules to be with us today. For now, and to formally close our webinar, you already know her. She's the one who does excellent po synthesis and closing remarks. She's the Deputy Director for Health Operations of the Philippine General Hospital. Please welcome to your screens Dr. Stella Mariose.
Good afternoon, everyone. First of all, I would like to thank our speakers. They all gave excellent discussions. Dr. Evelyn Rojas, Dr. Belle, and Dr. ZELIG Javier. Dr. Evelyn Rojas reviewed the transmission of dengue, and according to WHO, dengue is endemic in 100 countries, and the Philippines is number one in the high-risk nationals when she presented that table. Initially, there was a decline in our trends in dengue. However, later on, in 2020, there was an increase in fatality rate to zero point 0.6. And she emphasized that the fatality rate should not be more than 0.1%. Now, this significant increase was noted in January 1 to December 31 of 2021, when we had 78,872 cases, and in January 2022, as high as 26,365 just in 1 month. And dengue cases was increasing since the end of March. Now, she also reviewed with us the transmission of the cycle of dengue, and she mentioned the Aedes aegypti as the primary culprit, and it transmits the flavivirus, and there are four serotypes of dengue, and also the Aedes species carries with it the virus, and it's like it also can transmit the chikungunya, the Aedes aegypti, chikungunya, and yellow fever. She mentioned the transmission and the phases. You have the febrile phase, you have the critical phase, and the convalescent phase. And she also mentioned that the gold standard really is PCR, or the polymerase chain reaction. But more commonly in hospitals, we do the antigen detection test, no? And in the treatment of dengue, what I want to point out is that the medicines that we should avoid, no? That is aspirin, the non-steroidal anti-inflammatory drugs, and the steroids. Now, she mentioned the preventive measures such as the cleaning of the drains, the tires, the canals and the bottles, the flower pots, water containers, rain gutters, and the pails. And other preventive measures are wearing long sleeves, use of nets, mosquito nets, aircon room, and insect repellents. Okay, so those were all noted. And with the lecture of Dr. Belle Ranile, a very interesting lecture, no, on the experience of the Cebu province and the outpatient service. She mentioned that the primary infection is usually non-serious, and the secondary infection may cause severe dengue. She attributed this to increased rainfall. That is when we have typhoons. And as of May 28, 2022, there are 4,623 cases and 38 deaths in Cebu alone, and the case fatality rate was 0.8%. Now, one of the factors that she attributed this was the late checkup, or the late the patient was brought in late to the hospital. Now, as to the difference, no, she mentioned that there's no significant difference between the dengue infection among females and males. However, there's a significant increase in the 1 to 10 years old. Okay, so it's really the children who are most affected with this, and 47% of patients were children. Now, this was attributed with increased mobility, and children were more attractive because of the emission of carbon dioxide. And you know what I found so sad was the Cebu City dengue death table that she presented. The date of admission is the date also that the patient expired. So that means when the patient was brought to the hospital, it was already too late. So that is late consultation. That's why nothing could be done anymore for the patient. And she also attributed it to the increased humidity, and increased temperature. That is the role of climate change. And she mentioned that day 3 to 6, if there's something that you have to really memorize, it's that one. Day 3 to 6 is when the patient, if it is severe dengue, that is when the patient will crash already. So the temperature will rise, there's no fever, but the patient will go in shock and she will have bleeding and the hematocrit will rise and the platelet will go down. And there was an interesting study that she mentioned, the assessment of dengue and COVID-19 antibody rapid diagnostic test cross-reactivity. No? So there is a high specificity across all COVID-19 rapid diagnostic test brands versus dengue. And this was confirmed in their sample. However, 6.3% of COVID positive IgG samples also tested positive for the dengue IgG, and 21% of the IgM, COVID IgM positive samples also tested positive for the dengue IgG. So there's a cross-reactivity between COVID and dengue. However, the study also mentioned that dengue and COVID can occur together. Okay, so she mentioned she mentioned also the strategies in the dengue control, the surveillance, the case management and diagnosis, the vector management, the outbreak response, and the health promotion and advocacy. In summary, she said that the rising number of cases is influenced by rapid rainfall, urbanization, distribution of the principal mosquito vector, and there should be early and rapid screening, prompt recognition, appropriate management, and preventive strategies. They are vital in reducing the burden of dengue. And we have to emphasize community participation is the key to the control of dengue. This was also emphasized by the third speaker, Dr. ZELIG, who mentioned that early case diagnosis, management, and referral is very important. There should be active surveillance, and you check the active case fatality rate, and the active cases, and the CDC monitoring, the NS1 and the rapid diagnostic test and routine follow-up. Now, this is very interesting because really Cebu, they have a very massive campaign against dengue. And if you saw his slides, and I want you to review the webinar in our YouTube channel, you see the extent that they Cebu has done. No? They have the integrated vector management. There is the ultra low volume misting, the curtain chemical impregnation, the installation of insecticide treated nets, no, and that is placed in buildings. And they also have an effective surveillance system where they utilize the Philippine Integrated Disease Surveillance and Response System. Okay, and he mentioned that health education is a very important activity to eradicate dengue. So they lecture in mothers and other patients. Now, what are the issues during the pandemic? So the problem was there was realignment of the personnel, the nurses, the doctors, to COVID. So dengue was set aside, okay? And there was a limited and fewer surveillance of dengue, limited face-to-face consultation, and the delayed health-seeking behavior. In conclusion, Dr. Javier mentioned that dengue intervention can be hampered, they can be separate from each other by the COVID-19 situation. The increase in death rate is attributed to the poor seeking behavior in the community. And the community, as well as the policymakers, play a vital role in eradicating this disease. So it's not only the government who should be on top of it. We in the community could also help in our own small way. Back to you, Raymond, and BBPP.
Thank you so much. Deputy Director Stella. At talagang wala pong minor na detail na nakakaligtaan si Dr. Stella, lalo po pagka usaping synthesis at closing remarks po ang pag-uusapan. Maraming salamat po, Ma'am Stella, and really sometimes we feel it has become a highlight po with regards to, especially if you see all of the comments at saka yung inyo pong mga reactions sa inyong closing remarks. So next week, we will continue on po no, with another exciting topic. A lot of us have our own personal experiences, especially for those who are have households po na may family members na mayroon pong, let's say, medyo may mga seniors na po. A lot of them have what we call dementia. May mga nagsasabi po, nag-share po ng kanilang experiences with regards to forgetfulness and along those lines. So please, we hope you'll be able to join us po no again for next week. We'll be having the director of the Institute of Aging at the UP Manila National Institutes of Health, Dr. Shelly De La Vega, and we also have an invitee po from the UP College of Medicine and also the Philippine General Hospital's Department of Psychiatry. So please stay tuned. It will be a really exciting topic, and we all know this is something that a lot of you have requested po in our previous webinars. Before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content week in and week out. So maraming salamat po sa inyong lahat. And finally, all Stop COVID Deaths webinars are archived for viewing at the YouTube channel ng TVUP po, no? Again, if you go to open your browser and then type in www.youtube.com/TVUP-PH, you'll be able to find all webinars 1 to 102, and then after this webinar, magiging 103 webinars na po siya. So this formally closes our webinar for this week. Again, sana po magkita-kita po tayo sa next week po natin sa ating next Friday from 12 noon to 2 p.m. It's a date.
Sorry, nakamute pala ako. Together, we can stop COVID deaths.
Okay, so keep safe, keep healthy, and see you online!